Welcome to a new episode of Health Matters. In the studio with us today is Dr. Wanda Viegas, Senior Medical Officer at the Antiretroviral Therapy Center of the Goa Medical College in Bambolim. She is a dermatologist who has specialized in HIV and AIDS medicine and has been in this field for the last 14 years. Dr. Wanda is a member of the St. Luke's Medical Guild. We will be talking about the scenario of HIV and AIDS in Goa and the way forward. Dr. Wanda, thank you for being here today to talk on the subject.
Thank you for calling me.
Not at all. It's a pleasure to have you. And first off, if you would just tell us what made you specialize in the field of HIV and AIDS?
I was a dermatologist who got this post in the ART center, and when I went for the interview, I felt that I am the person for this post because there is skin associated with venereal disease. We say skin and VD, venereal disease, and AIDS is transmitted mainly by sexual route. So I felt I can do justice to this post.
Okay.
And that's how I joined, and then I began loving what I'm doing, and then I did my fellowship in the HIV medicine. I did an online course, and today I'm where I am.
Well, so what is HIV and what is AIDS? How are they different?
Like HIV is human immunodeficiency virus.
Yes.
And AIDS is acquired immunodeficiency syndrome. Now this virus, when it enters into the body, it goes to the immune system. It likes a type of T lymphocytes called CD4 cells, which it starts destroying. One side it is multiplying rapidly, and the other side it is destroying these T lymphocytes, the CD4 cells. So gradually the immunity goes down, and the viral load increases. So when the immunity goes down, then the person is susceptible to infections.
Right.
And that is called opportunistic infections. So initially the patient's immunity is good. So he's in stage 1, then he goes into stage 2. There are 4 stages in HIV.
Okay.
The first 3 stages, we will say that the person is HIV infected.
Okay.
And when the person's immunity completely goes down, he's full of opportunistic infections, and those also, mind you, are very serious ones. We say the patient is a case of AIDS. So not everybody is AIDS. Report is confirmed as a seropositive case, it means he has HIV infection. But if he doesn't take treatment and the support and therapy that is given, he can go into AIDS. That is the last stage.
So what you're saying is that before reaching the stage of full-blown AIDS and after being definitely HIV positive, there is a route to prevent them getting to that stage as well.
There is definitely. There's a lot of help and care, support, treatment which is offered by the government, by NGOs, which the people should come forward and take.
Which I'm sure we'll talk about as this goes on.
Yeah.
Now, what is the present scenario with HIV and AIDS in India and in Goa in particular?
Like in India, we are the second country after South Africa, and we have around 21.40 lakh cases detected. Last year itself, in 2017, we had around 84.4 cases, 1,000 cases detected, new cases detected.
Okay.
In Goa, the first case was detected in 1987. He was a
Okay.
foreigner. Then in 88, another case got detected. He was a non-Goan, but an Indian. Then in 89, there was a Goan student got detected to be HIV positive. And from then till now, we have around 17,000 cases.
Wow.
And we have around 1,800 AIDS cases. We have around 1,100 AIDS related deaths.
Every year?
No, this is
In
over
total.
the period only.
Okay.
Yeah. But what happens is that people are so frightened, they go into hiding, they hide their status, they don't come forward for treatment, and they reach us last when they are full-blown AIDS. It becomes very difficult to treat their opportunistic infections and make them survive. So the
Right.
death rate is high that time.
What are the causes for the present situation in Goa?
Goa being a tourist state, there's a lot of tourism based evils that are going on. So now I said how HIV is transmitted. First is by sexual route. 90% of the cases is by sexual route. 3%, 3.3% is from parent to child, from the mother to the child. Then around 1.1% is to blood and blood products. Then there is IV drug abuse, and there is a minimal amount through occupational exposure. That's usually doctors, nurses and all, which is negligible. Now, knowing these routes of transmission, we should know what are the infective fluids. Now, the most infective fluid is blood, then semen, vaginal secretions, body secretions like ascitic fluid, fluid in the stomach, pericardial fluid around the heart, pleural fluid around the lungs. This contains high amount of the virus. So if there is contact of this virus-laden secretions with the other normal person, if there is a break in the skin, if he's got injuries and all, or the needles goes into his body, then there's chance of transmission. So I've covered up sexual route and tourism, so that is one thing. The other thing is migration. There are a lot of people are seeing a lot of opportunities and coming into Goa. So along with that, they are bringing a lot of infections. And also, even if they are not bringing infections, what is already there, through unprotected intercourse and all, it is spread.
Right.
So this is one thing that we have to really look into.
Okay. Is there a particular demographic that you see affected by the virus and the disease?
Yeah, we see in the age group of 50 to 45, the cases are more. I have few ladies who are in the age group of 60, whose husbands have died when, 10 years before, 15 years before. Then in, if you see North and South Goa, in North Goa we have Bardes and Tiswadi Taluka, which is having lots of cases. In South Goa we have Murmungao and Salsit Taluka.
Okay.
In men it is more. Ladies, the prevalence is a little less, and now children are also getting it, like from mother to child.
What are the symptoms exhibited by or experienced by an HIV positive patient?
Like usually in stage 1, stage 2, the patient is healthy, absolutely healthy. He may not know also, he may get a usual viral infection like a cold, a fever, body ache, headache, which are like a normal viral. We'll say, oh, he's got a flu. And the doctor, if he doesn't have an inkling about, in the back of his mind, he thinks of HIV, he may also not suspect it. So that, then herpes zoster is the most common infection that we normally see. A healthy person coming with an episode of herpes zoster, we should think, why? Okay. Then TB is another infection which is very common. Pulmonary TB?
Yes.
Yeah, that is very common. So if a young person is getting TB, we have to suspect, we have to do an HIV test. So
and is this in terms of doctors being clued into these, being, when I say doctors, I mean a regular GP, because that's probably the first point of contact for something like a cold or even an unsuspecting patient who has TB. Do all doctors know that automatically one should be connected to the other and a check should be done?
No. In the private sector, it becomes a little problem because we need to have, there's something called the pre-test counseling, there's a post-test counseling when the test is, before the test is done, and then after when the report is being given. That is not being done. Like in the private sector, it becomes a problem. How are you going to tell a healthy person you have to do your HIV test? It becomes a real dicey situation. While in the government sector, it is like, a battery of tests, and we have to do this. Like we have to do this test to protect you and to protect everybody.
Okay.
So like that. So, but in the private sector, it becomes a little problem.
Now, World AIDS Day was recently celebrated on the 1st of December. What was the theme for this year?
World AIDS Day is celebrated to show our solidarity with the people living with HIV/AIDS.
Right.
And this year's theme was Know Your Status. So what is there to test? Like we go in for a routine blood sugar or cholesterol or a lipid, lipid profile, this, that we do. Why don't we do an HIV test as a routine? What is the big deal about it? So know your status. Because what happens, once a person knows his status, there's a window open of care, of support, of therapy, which is like the person gets denied if he hides and goes into, or he doesn't know his status.
Right. So how can a patient be diagnosed to be HIV positive?
Like if in GMC, if the person is like sick, coming with symptoms, and the medicine department, like he will be along with the other test. If the doctor is suspecting, he'll ask for the HIV test, which is done in OPD 6. Then this test detects antibodies to the virus. Then in suppose now gynec, if there is a pregnant lady who has come, every ANC case, antenatal case, the test is done because we have to protect the child.
Right.
In pediatrics, they will also do the test. So like that, all the departments, if they are suspecting something, depending on what the problem the patient is come with, they will ask for the test.
And this HIV test that you mentioned, is it the same as the ELISA test?
Yeah.
The same.
Right.
Okay. So what is the mode of treatment for this disease? Is there a cure for AIDS at all?
There is no cure for AIDS, but there is therapy. And with this therapy, that is called antiretroviral therapy.
Yes.
So with this therapy, the patient can lead a healthy life. He can have longer lifespan. He can have a better quality of life. He can go to work. He can get married. He or she can get married. They can have children. So there is lots of things.
Okay. And what does the treatment cost a patient? Is it cost prohibitive at all?
In our ART center, we give the treatment free. Like there are 3 lines of therapy. There is first line therapy, which comes to around 1,500, which is given free in the ART center. We have second line therapy, which in private could be anything between 6,500 to 8,500 per month, and that is given free in the ART center. And we have third line therapy, which would be somewhere between 15,000 to 18,000, which I filter out these cases, second line failure, and I send them to JJ Hospital in Mumbai.
Okay.
That is the center of excellence for Goa.
I see.
Yeah.
Okay.
So they have to go there and collect the medicines.
Okay. And when you talk about first line, second line, third line of therapy, what do each of these entail? Is it oral medication?
These are tablets. Like now first line, first initially there were so many tablets that the person had to take. Today it's just a single tablet with all the drugs in that.
Okay.
It's a cocktail of 3 drugs, but it's single tablet,
Okay.
which the person has to take 1 hour before food or 1.5 hours after food.
Okay.
And that's it. And so before that, when a person comes to the ART center, I take my counselor takes all the details. Then I take a detailed history. I do all the investigations because we have to rule out opportunistic infections. And then with counseling, get the person ready and start therapy. Because this is not something which you take for a few days. Like antibiotics may be 15 days or even 7 days therapy. But this is lifelong therapy.
Right. Now, are there any or is there an authority that is concerned with the spread or the control of this in Goa? Who are they and how are they dealing with the scenario?
Like at the national level, we have the National AIDS Control Organization.
Okay.
Now this was started in 1992 under the Health Ministry and Family Welfare. So they had, under the leadership of these AIDS control societies, like we have in Goa AIDS Control Society.
Okay.
So through them, the national ART program was brought into the state.
Okay.
So like that we have Gujarat State AIDS Control Society, Mumbai State AIDS Control. So each state has its AIDS Control Society.
Okay.
So through that, the medicines and whatever, everything comes to the grassroots level.
Okay.
Yeah. So Goa AIDS Control Society is in Panjim.
Okay. Now, can AIDS be prevented
Definitely.
and how?
AIDS, like HIV infection, can be prevented. Like I said, what are the routes of transmission? If we control, like
Yes.
have protected sex, like wait for the right time to have sex, have protected sex, have with the right partner. Then in the blood bank there is stringent testing, and they have brought down the level of transmission through blood products to a very minimal level.
Mm.
We have something called PPTCT in the OPD, gynec OPD 24, where that is prevention of parent to child transmission. So over here, an ANC mother who is tested to be positive is referred by this PPTCT counselor directly to the ART center.
Okay.
So at the ART center, then we take a detailed history. I do all the checkup and like talk to the patient. And instead of waiting for investigations, I start the lady on therapy first.
Okay.
Yeah. Because that's most important thing, because we don't want, at the time that she is calm, henceforth we don't want the virus going to the baby.
Right.
So that's why we start therapy first and then do all the investigations.
Okay. Um, Now, we often see the red ribbon, as a symbol whenever somebody talks about AIDS, etc. What does the red ribbon symbolize?
The red ribbon is an awareness ribbon, and it is to show solidarity with the people living with HIV/AIDS.
Okay.
So anybody, like on World AIDS Day, everybody was using. So we are there for you, like you're not alone type. That was to show solidarity. There are even red ribbon clubs.
Okay. So then, since you talked about support and solidarity, what are some of the greatest areas of concern for patients, but also for their caregivers? And how can patients living with the disease lead normal lives? Are there any do's and don'ts for them as well as for caregivers?
Like the first question the patient, when he comes with a positive report and he comes and meets me, like by now everybody knows Dr. Wanda and HIV.
Okay.
Okay, they come directly sometimes. I want to meet Dr. Wanda. Like we say, there is a protocol to be followed.
Right.
Like first registration, the community care coordinator, she'll make an entry into, she's at the entrance of our ART center. So an entry is made because NACO is very particular about the number of cases that we see per day. New cases, what we do, why have they come?
Okay.
So that way, so that register is maintained. From there they will go to the counselor. I have 3 counselors. So the counselor will take the detailed history and the detailed information, everything about the caregiver, address, phone numbers, income, anything, everything. So then, and we have a green book which is with the patient, and we have a white card which is our record, ART record. So all that is details, everything, past history, everything is filled. Okay. Even social issues like alcohol or drugs, all that is. And from then the patient comes to the doctor. So when they come, the first question they ask is, how long will I live, doctor? So that is their main worry, because they still don't get it that HIV is become a chronic manageable disease.
Okay.
It's no longer a deadly disease, and we, like with therapy, person can live a long life. I have 2 patients who are now 20 years into therapy and they're leading healthy lives, but they are taking their treatment, they have to be religiously. I tell patients like how to put in layman language. I said, you've got a motorbike, you're going to put petrol for that motorbike to run. So your body is your motorbike. You have to every night put that little dose of petrol in that, and at the end of the month, if the tank is empty, you come to the ART center. We will fill it up for you. Okay. So we give 1 month therapy. Now NACO has been very kind. First they said give 2 months therapy, but now they said those who are 100% adherent, who are taking good care of their health, nutrition, and who have no other infections and all, we can give them for 3 months. So we give them 3 months therapy and they come 4 times in a year.
Okay.
Yeah. Okay. So that is thing. The caregiver now, caregiver's worry is we are living with this person. If we touch them and if we eat from the same plate, their main worry is we have small children around the house and won't they get infected? I said no. There's by hugging or by kissing, eating from the same plate, feeding, it doesn't get transmitted. So there's nothing to worry. Rather, they need that family support. They need care. They need that emotional support. They need the nutrition that the family can give. Nutrition, food. So all that helps in the person to lead a healthy life.
Right. Okay. Now, at the ART that you're talking about, that you spoke quite a bit about just now, do you attend to children and pregnant women also at this center?
Yes, definitely. We have on Mondays, we have a special OPD wherein a pediatrician, the consultant of pediatrics, she is sitting in OPD 14. Okay. So she attends to them, like they register with us, then with the books they go to the pediatrician, she checks them up and all, and then she refers back to me and I give the medicines and all. Otherwise, like other times I see them. Pregnant ladies, yeah, from OPD 24, gynec OPD, they are referred directly to us and we attend to them, whatever like they need to be told, counseling, everything is being done.
Okay. You also mentioned earlier when pregnant women come in, advising them in such a way to ensure that they deliver normal, healthy babies. Can you tell us a little bit more about the kind of guidance that you'll give them to ensure that this happens?
Like now this PPT city counselor who is there, once this case has come, her report shows that she's seropositive. So she will refer to my counselor.
Okay.
So my counselor will register, we will form the cards, and she'll come to me. My counselor will counsel about therapy and everything, and then they'll come to the doctor. So I have a junior doctor also, like I just got, and we will talk. We will tell either me or she, whoever. Like we will tell them about nutrition, care, and adherence to treatment, because these have side effect also.
Okay.
So we'll tell them, for your baby, you have to look after your health for your baby, because you want a healthy baby. So for that you have to take therapy, you have to do the investigations, whatever, because at the end of it, all this, we at 18 months we get a negative child. That is the best gift we could give a child.
So, is it always possible to have a normal, healthy, uninfected child, or is
Like from the time this PPTCT program rolled in,
Hmm.
we have 20 children who are negative. So that's a nice thing for us. Like
Okay.
all the mothers have taken the treatment and all, and we have. So it is possible. I can't guarantee. We
Yes.
can't guarantee for anything. Something can go wrong. Like there was one woman who had miscarried. So like that, I can't guarantee those things.
Hmm.
But if the woman takes a treatment, 100% adherent, and all that follows, there is follow up with ART center, and there's follow up with the gynec. So we hand in hand we go together, and at the end the result is good mostly.
Okay. And you talked about side effects. You just mentioned that
Yeah.
there are side effects. What are some of the side effects of the medication?
These are very strong medicines. Like it's cocktail of 3 medicines,
Yes.
three different drugs in one tablet. Now the present thing that we give, tenofovir, lamivudine, and efavirenz. These are 3 drugs, and efavirenz causes a little CNS side effects. So they feel drowsy. They feel where there are few people who felt they have no sleep. They weren't getting sleep, insomnia, but most of them complain of sleep as though a hangover type of feeling, which
Okay.
passes off in 2 or 3 weeks.
Okay.
So we tell them, you take it before, like how to take, what to do, drink a lot of water and all that stuff. We tell. Everything is a lot of counseling effort goes into counseling. So we don't want them to stop the treatment because of side effects. So that's why.
Right. Okay.
And that's the main reason why people default, side effects of therapy.
I see. Okay. One other thing struck me when you mentioned them first coming into the ART, and you talked about the green book and the white card, and you said all of their information is taken in terms of their history, their social habits, etc. And you talked about alcohol and drugs. Are people who come in always truthful about that?
Usually, but whilst divulging their personal details, now because government is giving some social dole and all that DSSY scheme, now they are coming with this is my original name and all that. Now they are coming forward.
Okay.
But we ask for ID,
Hmm.
Aadhaar or something, some ID. We ask them when we register them, and now especially because it's becoming difficult to trace defaulters, those who don't take therapy.
Hmm.
We have to trace and get them back into the system. There's a lot of effort, time and money spent in trying to get these people to come and take their treatment on time, so that we don't have resistance. Because this virus is such a shrewd thing, no? It multiplies so rapidly and it mutates, it changes its form. So resistance develops fast.
So how do you go about reaching out to people to ensure that they are not defaulting? Those that keep coming to you regularly is fine, but those that try and get lost in the system?
We have NGOs which are outreach workers who we give the address. At the end of the month, my data manager will, all the information is in the computers. So data manager will take out a printout and give to the outreach workers. So they will do, first my community care coordinator is there. She'll give a call on the numbers. Most of the numbers are wrong numbers or disconnected or something like not working. Then we take the address and we give it to the outreach workers, and they do house visits and try to locate the people and bring them back.
Okay.
Yeah.
Now, AIDS is an area that the United Nations has been focused on for decades. You, and I know that NACO has certain goals, etc. So, could you give us maybe a breakdown of what is happening with the UN brought down to grass level in India and how NACO functions?
Like NACO is at the national level in the capital, as I already said, like through the AIDS Society they function, and there is a monthly report sent to NACO from each and every ART center.
Dr. Wanda, you just mentioned the PPTCT coordinator. Can you tell us more about that program? And
In the gynec OPD, there is these counselors who are sitting in that PPTCT program, that is prevention of parent to child transmission. So the ANC case is, once their test comes positive, this counselor will refer them to the ART counselor, and we will do the needful of starting the therapy and doing the investigations, counseling about nutrition, care, adherence to treatment. Everything will be done in the ART center. Their job is to do the test of the pregnant ladies, positive cases, their husbands to be tested and to be referred to ART center.
okay.
So once I put them on therapy, treatment, antiretroviral therapy, the mother has to take. It will reduce the amount of virus in the blood of the mother.
Okay.
So the amount of virus going through mother's blood, through the placental barrier into the baby will be less, will be negligible.
Okay.
And the baby will be born after
And
9
that's
months.
how, okay.
The baby will be given antiretroviral therapy, a single drug called nevirapine, for 6 weeks. After that, we will give the baby an antibiotic called cotrimoxazole for 18 months till the test, that is at 18 months when the test comes negative. We will test the baby at 18 months. If the test is negative, then the child is negative. First, at 6 weeks, the child is tested. First test we do at 6 weeks after birth. Then we do at 6 months. So we are going on keeping a check on the child. In between, the test comes positive, we put the child on the 3-drug therapy.
Okay. And if the child happens to come positive at that stage, then does that mean
if
a
that
lifelong?
test, if the first test that is done, that is called a dry blood spot, that's just a spot of blood, a drop. If that comes positive, then we do DNA PCR, whole blood. The blood
Okay.
is taken, and if that comes positive, the child is positive and has to be on 3-drug therapy,
Lifelong.
lifelong.
Okay.
But if that comes negative, then we repeat the test at 6 months, then at 1 year, and 18 months is the final thing.
Okay.
Yeah. So if that is, but we keep the antibiotic, everything, nutrition, everything. We counsel the mother, the care on the child with the pediatrician. We both go together, pediatrician and this. So we want a good baby, a healthy baby.
Right. And is the pediatrician just part of the pediatrics department at the GMC, or
She's a consultant in the pediatrics department.
Okay. Now, at the beginning of the interview, we talked about India-wide statistics, right? And you've mentioned the National AIDS Control Organization. Can you tell us more about it and what its goal is?
Like National AIDS Control Organization, it had these goals that anybody from the suspected population. Suspected means like men having sex with men, IV drug abusers, commercial sex workers. So all these people, like those who are suspect, they should be tested. So they came up now. They came up with 1990. So suspected population should have their tests done. Those whose HIV test is done and they are turned out to be positive, they should get therapy.
Okay.
And the 90% of those should get therapy, and the third 90 is that 90% of those should be 100% adherent to treatment, and they should be virally suppressed. Their amount of virus, that is the viral load, should be undetectable.
Okay.
So that means if the virus is undetectable, the transmission is zero, negligible.
I see.
So
Okay.
that way we will be able to control the infection. So that is NACO's goal. By 2030, we want no new infections. We want like zero deaths, AIDS-related deaths, and we want zero discrimination.
Okay.
So 2030.
Zero
So we have to work towards it.
Okay. And do you think that the National Antiretroviral Therapy Program is making a difference in terms of the prevalence of the disease?
Definitely. People who are on therapy, who are taking their treatment properly, are virally suppressed, they are keeping good health, they are going to work. This has helped families to be together. If there was no therapy, say the father gets the infection, he passes on to the mother. The father will get very sick and he will die. The mother will go to work, she will neglect her health, she falls sick, she dies. The children are left alone. Sometimes from the mother it goes to the child is on therapy. The whole family is broken up. So
Okay.
if the people take the treatment properly, they can lead a healthy life. They can have a good life, good quality of life. There is no need to be sick and admitted every now and then into the hospital with serious infections. So much money goes in the treatment of those infections. There is nutrition. So sometimes what happens is these people who are poor, they will stop their children from going to school. They may be made to work or do the housework, and so their education is compromised.
Right.
See the way the disease is going and destroying every life. It's not just one person who is infected. The whole family, is broken up.
Now, you mentioned education. I'm going to ask about education in a different context, which is that there has been a lot of, resistance towards starting sex education, for example, in schools. Now, you also said that starting to see youngsters, and the demographic that you see starts at the age of 15 going up to 40, 45. Clearly, there are youngsters out there who need to be educated on what causes this, what to fear, what not to fear, and maybe carry some of that information back home. Is that being plugged into the educational system at all, to your awareness?
There is a lot of awareness being created. There's red ribbon clubs and all, I said. No, there are youngsters involved in those clubs. There's awareness created. There are people who have street plays to create awareness among the people, youngsters also. There are programs. They have through NACO, Goa State AIDS Control Society has involved, they create awareness among the police, Anganwadi workers, and everybody. Everybody should be aware about this disease to protect themselves, protect their young ones, and to give care and support to the person who is infected. So there is a lot of work going on. There is a lot of awareness going on through GSEX. They have pamphlets. They have talks being given.
Okay.
Then they have blood donation days. That day they create awareness about it.
Okay.
Then this World AIDS Day is celebrated. Then like this time in that Garcia the author, they had nice poster competitions, plays, and so many things. And there is an NGO, Human Touch, also, who works very actively with these people and children and all. What is happening, now these children who were infected with HIV, they are grown up. They become like 20, 24, 25. They have to go into the society. We have to educate them. We have to give them some vocational training, those who can do further studies, help them to get educated, get a job or something, and be independent and go into the society. They have to amalgamate, they have to mix up in the society. We can't keep them isolated, as a separate thing.
Right.
No, everybody has to be together. We have to be together.
Okay. Now, my next question is important, particularly for, I think, the viewership. Are there any myths about HIV and AIDS that you would like to debunk?
Like some people say, this if the mosquito bites, bites and then bites me, will get. No, it is not transmitted through mosquito bites. It is not transmitted through kissing. Unless there is some deep kissing and injury is caused and there's blood and all, otherwise no. There is no, if you hug the child, you take the child, or you're not going to transmit the infection to the child. There is no way. But unprotected intercourse and IV drug abuse, all these things, the negative things, they can put the person in trouble.
Okay.
So, and this thing about many people say, how did it happen to me? We are, even you and I, we are not something who are Superman or something. It can happen to anybody. It is our duty to use the knowledge to protect ourselves and others.
Okay. Do you have a message for our viewers?
Yes, I would seeing the age group, seeing the people that, they feel sorry for themselves afterwards. Like the youngsters, I would tell them, go to school, finish your studies, get into some trade, get independent, instead of, going a little off the track and falling into trouble, like teenage sex, teenage pregnancies, IV drug abuse, all these things are a big no-no. It would be nice. It would be nice if all of you all remain healthy. That would be the best thing that we could, have in this world. Then for adults, we would, I would say, stick to one partner. Use protection. That is the only thing. Each one should decide for himself. But seeing there and then I feel sorry. There is no use afterwards.
So focus on the business of life and living well.
Life is good. We just have to take it. Say thank God and go ahead.
I suppose so.
Yeah.
Well, thank you, Dr. Wanda, for sharing that wealth of information and knowledge with our viewers. I'm sure we're all going away far better informed than earlier and definitely oriented in the right direction. And there you have it, folks, a guidance manual on one of the most feared diseases to ever afflict humanity, how to view it, how to handle it, and most importantly, how to be with our brothers and sisters who may have been affected by it. There is a song I learnt long ago that said, "People over the world, reach out your hand, touch one another. People over the world, just understand and love each other." I think never has humankind needed those sentiments more.